I think that if you look at our healthcare system that we have in this country, it has some real strengths and some real weaknesses. We have remarkable quality healthcare in this country. If you're going to get sick anywhere in the world, you want to be here. As long as you have access to healthcare, you want to be here. Because I think we have the best healthcare there is in terms of treating disease. Let me give you one sidebar statistic on that. Cancer survival rates. There are a lot of ways to spend statistics, I know, but cancer survival rate, United States compared to Europe, if you're a woman, your cancer survival rate is 11% better in the United States, and if you're a man, it's 20% better in the United States. So we have good quality opportunities here. What don't we have? Well, we have a system that where 47 million people don't have health insurance. And we have a system where the costs are exploding. You talk to any businessman who is involved in buying health insurance for his company, his or her company, and they will tell you how these costs are growing at a much greater rate than inflation every year. And you don't need to be an economics major to know that if costs are growing at a greater rate than inflation every year, you can't sustain that over time. That is not a sustainable model. If you are concerned about the debt that is growing in Washington, in case you didn't know, there's a debt issue in Washington. Healthcare is by far the biggest dynamic that's affecting that. Because roughly speaking, I'm just rounding numbers, so don't hold me to the exact 50%, but roughly half of all we spend, all federal spending, is healthcare. It's Medicare, it's Medicaid, and it's veterans healthcare. That's half the, if you do a pie chart, that's half the pie right there. So if it's growing at 4, 5, 6, 7% over inflation every year, you're never going to get a balanced budget if you sustain that over time. Now, I don't think there was consensus across the country in the past year that those are the two problems. That was part of the problem with this debate. And I think it's really unfortunate the debate ended up where we ended up. So I don't think we ended up with legislation that really addresses the two problems in the way I would like to. If you do coverage without reform, you know what you get? You get Massachusetts. Massachusetts passed comprehensive health reform about 3.5 years ago in a bipartisan way. And it covered, a number of people were covered, and that's a good thing. But you know, last year, 1 in 5 people in Massachusetts at some point didn't have access to health care because of costs. That the costs have outstripped the subsidies that provide the coverage for everybody. That the primary care wait times in Massachusetts are the worst in the country, even though they have the highest concentration of doctors of any state in the country. See, this is the point, is that you can't sustain this massive cost growth that we're experiencing. You have to do what's called actual reform. I don't think the status quo is the right position, because we're going bankrupt as a country on healthcare. We have to look for reform. We're overutilizing our healthcare system. It's, by various studies, roughly 30% of all the procedures done in America are not medically necessary. 30%! Imagine running a business where 30% of what you're doing doesn't contribute to the business. Why are we doing that in this country? There are two sort of fundamental dynamics out there that create the incentives that I think allow that to happen. One, doctors and hospitals and home health. It's not just docs, this is the whole provider community. Doctors, home health care providers, hospitals. There's a fear about being sued. And so people practice defensive medicine and do more procedures to kind of cover their backside as many ways as they can to avoid getting sued. And so you need a malpractice or tort reform dynamic in our system today. How do you get paid in the healthcare business? You get paid by procedure. The more you do, the more you get paid. You don't get paid on quality, you get paid on quantity. Now, I'm not saying all docs and hospitals and healthcare providers are greedy people who are just doing extra procedures for the sake of making money. I'm not trying to cast this big negative comment against all of those people in that industry. I'm just suggesting that the compensation system creates what I think is a perverse incentive. You got to deal with that by doing tort reform and payment system reform at the same time. The legislation that passed Congress doesn't do that. I just think, and by the way, this is a new law. We still have to deal with this issue. This debate isn't over. Because this cost growth, if it continues, we can't sustain. And if we got this overutilization, we got to do something about it. It's not that everybody's doing the overutilization. There are a handful that are doing a lot of the overutilization. And so I think that that's another piece of this puzzle. There's no silver bullet here and there's no simple solution to any of these different healthcare variables. This is the most complicated issue I will work on in my career. So don't buy into the soundbite answers to this issue because this one is complicated. If you look at what we spend on healthcare, about a third of everything we spend is administrative cost. It's not patient care, it's paperwork. The most bloated, most bureaucratic healthcare system in the world is here. When my son was 2, he had the sore throat. We wanted to take him to the pediatrician to test for strep throat. Okay. Now, strep throat test. This is not some unusual or rare occurrence. Those tests are probably conducted in this country many thousands of times a day. We go in, we get the strep throat test. A couple of weeks later, I get a piece of mail and I say, I'm going to start a folder, a file folder. So I'm going to see how many pieces of mail I get. And over the course of, I don't know, 4, 5, 6 months, I got 8 pieces of mail. 4 from the insurance company saying, well, you may or you may not owe this, we're contacting the provider, and 4 from the provider saying, well, you may or you may not owe this, and we're working with the insurance company. 8 pieces of mail. And you know what the ultimate outcome was? I owed $20. The new law does a couple things that are helpful in this regard. The new law says that all the insurance industry ought to be working off the same sets of codes and forms. Because, you know, I talked to my wife's a doc. My uncle's a dentist. I talk to them. They talk about every insurance company has its own set of forms, own sets of codes. They seem to change every couple of years. It's a massive burden on the provider community, especially if you have a small practice. So I've given you 2 big buckets of opportunity. In a $2.6 trillion annual healthcare industry in America, that's how much we spend. You start adding up what a third of that is, or what 30% of that is, which is about the same. You're talking about, you know, hundreds of billions of dollars. So even if we make partial progress on those, you're talking about significant amounts of money. We got to find ways to make progress. Whether you like this bill or didn't like it, I think we got to find ways to make progress because I want to secure the future of our healthcare system in this country, and this cost growth doesn't sound very secure to me. So I think we all ought to buy into that notion that we ought to try to offer constructive ideas to make this better. When they drafted the Constitution, they created this process that has multiple steps and really forces consensus to get something done. The Constitution was written to create a moderate outcome, in my personal opinion. And when you have a polarized dynamic and you don't see much happening, that tells you the Constitution's actually working. I think putting out voices of reason is what we need in their system of democracy right now. I just think we need more of that. And the more people are engaged and talking about looking for practical solutions, I think the better off we are. Because if we allow just certain extreme elements with their own agendas to dominate the debate, that makes it more difficult to make progress.